Mr. President. This is Christina from Stratford, Connecticut. She's a small business owner, and she has a story that is becoming pretty familiar all across the country. She left a job a couple of years ago that provided for employer-based health care, and she wanted to start her own her own business in Bridgeport, Connecticut, right next to Stratford. So she stayed insured through COBRA for a period of time until it expired, and then she had to go out into the individual market. She recalls having to fill out a 15-page questionnaire when she was applying for individual coverage. She said it asked, quote, about anything that I have even remotely discussed with my doctor. And unfortunately for her, some of those things, pre-existing conditions, meant that she was denied health care coverage. So she had to go into Connecticut's high-risk pool, which meant that she was paying $1,200 per month. Anybody that started up a small business from scratch knows that that can be pretty prohibitive. Her salvation came through the Affordable Care Act. When it went into effect and Connecticut's exchange was established, she was able to find a plan that cost her $430 per month, which is frankly on the high end of plans, but it was much more affordable than the one she had. She says that I'm thankful that there was a solution for me to be able to keep my business and have affordable health insurance that can't be taken away. Mr. President, stories like that can be told all over the country, but it's not just anecdotes that we have to rely on any longer to talk about the success of the Affordable Care Act. I know that we're obsessed this week, appropriately so, with the Patriot Act and the Transportation Reauthorization and the Free Trade Agreement, Fast Track Agreement. But the Supreme Court is likely, upon our return after the Memorial Day recess, to rule on one of the most important cases that it's heard during most of our tenures. That's the King v. Burwell case. And so it's important to spend some time before we break talking about the subject of that case, the Affordable Care Act. Christina's story is miraculous. Somebody able to start a business, keep that business open because of the Affordable Care Act. But she's one of 16.4 million people all across this country who now have health care because of the Affordable Care Act, most through federal and state exchanges, but some because they were able to stay on their parents' plan up until age 26 or able to access Medicaid. Last month's Gallup poll showed that the uninsurance rate in this country has declined by 35% over the course of the last year and a half, since 2013. That is a remarkable number, and we shouldn't hesitate from noting that it is just absolutely exceptional in the history of this country to have a 1/3 reduction in the number of people who don't have insurance in such a short period of time. And the good news is that most of the folks who have insurance are satisfied, just like Christina is. We heard opponent after opponent of the ACA tell us that this was going to be terrible health care, that there's no way that the government can have anything to do with a health care plan that people would want. Of course, it's not government-run health care. It's subsidized by tax credits from the government, but it is private health care insurance with the exception of those Medicaid plans. J.D. Power surveyed thousands of ACA enrollees and found that they like their exchange plans more than people like their non-exchange plans. So healthcare on this exchange is more popular than healthcare off of the exchange. And the good news isn't just about the number of people who have coverage, it's that costs are coming down. The accountable care organizations, which are this innovation in the Affordable Care Act to try to build big integrated systems of care, the pilot program just came in with their savings numbers. $384 million saved just on this one innovation alone. That's $300 per patient. That's a big deal because it speaks to a larger trend line in which we are, for the first time in a very long time, able to control healthcare costs. On an annual basis last year, we saw the lowest increase in medical costs, the lowest medical inflation number in a generation. But costs are coming down in part because of things that we put into place through the Affordable Care Act. My colleague, Senator Barrasso, was down here yesterday with a wonderful chart about Connecticut and I appreciate him giving Connecticut a little bit of extra publicity, but his speech really was a wonderful advertisement for the Affordable Care Act. He noted that several insurers in Connecticut just came out with rate increase requests, and he had the numbers up there. They were, I think, 8% and 10%. They were substantial increases, not unfamiliar, because prior to the Affordable Care Act, that's what individuals and businesses were facing every single year, were double-digit increases. And the rate increases that Senator Barrasso was referring to were completely in line with what those same insurance plans requested last year in Connecticut. Last year, Anthem, Blue Cross Blue Shield, requested a 12% rate increase. Connecticut requested 12%. And because of the Affordable Care Act, which allows states to do reviews and amendments to those rate increases, Anthem's request last year went from 12 to 0. Connecticut's request went from 12 to 3. And we had in Connecticut one of the lowest increases in healthcare premiums on record because of the Affordable Care Act. And so it's right that these health insurers are requesting big rate increases, but now because of a law we passed, they don't get those rate increases in states like Connecticut. They actually have their numbers vetted, they have their actuarial analysis reviewed, and they get a different number to the benefit of my constituents. But this Supreme Court case that's going to come up is important because it puts millions of Americans at risk for losing many of the protections that I just talked about. It basically says that the Affordable Care Act was designed in a way to only provide these subsidies to help people get insurance on state-based exchanges. And if you were on a federal exchange, you by design weren't supposed to get these subsidies. Well, a lot of people talk about what the intent of the law is, but you don't even have to get into the intent of the law. On its face, the text of the Affordable Care Act is absolutely clear. Because yes, there is a reference, one line, to the fact that subsidies will flow to state exchanges. But the plaintiff's case completely ignores another section of the Affordable Care Act, which gives the Secretary the power to establish exchanges in states that don't do it themselves. That's what has happened by the substitution of federal exchanges for state exchanges. And of course, the text of the bill just does not work if you believe the plaintiff's analysis. The plaintiffs say that this was supposed to be a penalty, that if you didn't set up a state exchange, we are penalizing your constituents by withholding subsidies. Well, there's not a single line in the Affordable Care Act that suggests that this is a penalty. And in fact, the Supreme Court has said that if you want to do that, you've got to make it explicit, that you can't have guesswork involved as to the carrot and stick approach afforded to a state. Doug Elmendorf, who was the head of CBO at the time, said, "I could remember no occasion on which anybody asked why we were expecting subsidies to be paid in all states, regardless of whether they established their exchanges or not. And if people had not had this common understanding about what the law was going to do at the time, I'm sure we would have had a lot of questions about that aspect of our estimate." And then finally, the bill doesn't work on its face if you believe the plaintiff's argument. Why? Because the insurance reforms are national, and yet the subsidies, according to the plaintiffs, are only for states that establish their own exchanges. Well, the insurance reforms don't work if everybody doesn't have insurance in those states. You can't say that folks who have pre-existing conditions can't be discriminated against if people in those states don't all have insurance. That just actuarially doesn't work. And so the whole bill falls apart if you believe the plaintiff's case. And so I'm frankly totally confident that the Supreme Court is going to find in favor of the government, because there's no other way to read the Affordable Care Act other than to believe that subsidies go to both state and federal exchanges. It's plain on the face of the statute, but certainly if you have to get to it, in the intent as well. But we're starting to see that Republicans are thinking that they are going to need to have an answer if, in the unlikely case, as I believe, the Supreme Court decides in favor of the plaintiffs. But this is a pretty good summary of what the Republicans' plan is to respond to King v. Burwell. The Republicans' plan, if King v. Burwell goes in favor of the plaintiffs, is essentially a shrug of the shoulders. The predominant bill on the Republican side is offered by my friend Senator Johnson from Wisconsin. He claims that his bill is going to fix the problems in the Affordable Care Act if the King v. Burwell decision is decided in favor of the plaintiffs. But it is nothing except for just another attempt to repeal the Affordable Care Act. It's disguised as an attempt to address King v. Burwell, but it is simply just an effort to repeal the law. And you don't have to read too deeply in the bill to figure that out. It preserves the subsidies for about a year and a half, but after that period of time, it ends subsidies in the federal exchanges, and then it also ends subsidies in the state exchanges. Let me say that again. The Johnson bill doesn't just end the subsidies that the court might rule unconstitutional, it also ends the subsidies in the exchanges that the court won't rule as unconstitutional if King v. Burwell is decided in favor of the plaintiffs. Thus, it is a repeal of the bill. It goes well far above and beyond what would be necessary to address an adverse decision. It then goes even further. The Johnson bill then repeals the individual mandate. It repeals the employer mandate. And when you do that, the insurance reforms fall apart, because even Senator Cruz on the floor during his filibuster conceded that you can't protect people with pre-existing conditions unless you also require people to get insurance. And then lastly, the Johnson bill ends the essential benefits packages, so that this guarantee that if you buy insurance, you're going to get a basic floor of services is no longer. The Republican response to King v. Burwell is simply to repeal the Affordable Care Act. And I hope that we never get to the point where we have to debate how we address an adverse decision in the King v. Burwell decision, but this is a non-starter. And everyone inside this building and outside this building should understand that. I don't think it's a coincidence that all 30-something co-sponsors of the Johnson bill also support repealing the Affordable Care Act. But you can't deny that it's working. From the New York Times to the Washington Post to the Wall Street Journal, people understand that the Affordable Care Act is changing people's lives. 16 million people with insurance. Healthcare costs stabilized for the first time in many of our lifetimes. Quality getting better. The Affordable Care Act works, and I hope that our colleagues will come together, no matter the decision in the King v. Burwell case, to make sure that it continues to work for Americans all over this country. Thank you, Mr. President. I yield the floor.